We're recording our session today, and we're going to be sharing the recording and presentation slides with registered participants. And we're hoping that today's conversation is interactive. We welcome your reflections and questions in the chat or in the Q&A panel. So we want you all to give us your questions, thoughts, use emojis, react if you like something, if something really resonates with you, and drop your questions in the Q&A panel, which is at the menu at the bottom of your screen. You can also opt into closed captioning if you prefer, which is also at the menu bar at the bottom of your screen. And yes, please let us know if you have any issues with or technical problems, and we'll try to help resolve that. Next slide, please. So Health in Partnership, or HIP, which is the organization that I work with, is a national research, advocacy, and capacity building nonprofit organization with staff across the country. Our mission is to transform the field of public health, to center equity, and build collective power with social justice movements. We advance this mission in a few ways: through capacity building with health departments and health department serving organizations like NACHO and ASTO. We also do policy advocacy and organizing, and we are working directly with community power building organizations to advance transformative policy solutions and center health and equity in this work. We also do bridging work and relationship building across health departments and community power building organizations to strengthen those collaborations and advance better programs and policies for the communities that we serve. Next slide, please. Before I turn it over to our stellar panel participants, I want to spend a minute talking about the National Movement for Housing Justice and Rent Control, helmed by the Right to the City Alliance, which is a national alliance of more than 90 community-based organizations growing grassroots power to halt gentrification and displacement and build democratic, just, and sustainable communities. Next slide. For many years, Right to the City members have been working on building tenant power for rent control across the country, leading disparate organizing fights in their local cities, counties, and states to pass rent control policies or repeal laws that preempt rent control and other housing justice organizing efforts. We're going to hear a little bit more about the work that's happening in Massachusetts a little bit later. But just wanted to share a little bit more about Right to the City Alliance. Next slide. In 2025, Right to the City members voted to focus on translocal organizing campaigns for rent control. So meaning autonomous and place-based campaigns, but that are tied together into a broader aligned strategy capable of shifting normal practice and what is politically possible, and really doing this work together to build power and increase the possibilities to pass rent control and other housing justice and tenant protection policies. Next slide. HIP and Right to the City have been in partnership for over a decade, and we coordinated with organizers to design a health strategy for the translocal rent control campaign in order to bring the power of the health sector, so all of us here today, including support with research, narrative change, institutional power, advocacy, and other resources. Our goal is to help build a national drumbeat and prioritize support for local rent control campaigns, including supporting the organizing in Massachusetts and California, and other regions, including in the South and Midwest, going on into the future. Next slide, please. One way that we're doing this is through convening, just go back one more slide. Convening and mobilizing the Public Health for Community Power Coalition, a national coalition of leading non-governmental public health organizations who are coming together to strengthen our sector support for grassroots organizing. Raya Griffiths with American Public Health Association will talk a little bit more about this later. Together, the coalition has decided that rent control is a winnable campaign that the public health community should make a priority. So they work together to co-author and partner on the health benefits of rent control resource that we're going to be sharing with you all, and are working on developing a strategy to support the rent control organizing in Massachusetts. Next slide, please. This leads me to a final point regarding the current political moment of growing authoritarianism. I think we're all feeling the same thing. The integrity of public health programs, our democracy, and progress made to repair racial and housing injustices are at stake, while our families, neighbors, and communities are being publicly attacked and harmed. So we face a critical window to intervene, hold the line, refuse to surrender, and also be a beacon for a better and more just country and world. Next slide. Organizing for rent control, while it won't save democracy, is an opportunity to create wedges in the authoritarian coalition, pulling working people across race away from alignment with right-wing populism. If we do it right, we can build our collective muscle of hope, collective care, and grassroots governance. Chris Genesee at Right to the City Alliance has a great article on this, which we'll share in the chat, really bringing the connection and the intersection of housing justice, rent control, and the rise in authoritarianism. So we're going to keep this broader perspective in mind, even as we dive deep into rent control. So with that, I'd now like to turn it over to Will Dominy, Housing Justice Program Director with Health in Partnership and longtime housing and health advocate. So I'll turn it over to you, Will.
Thanks, Mariana. Hi, everybody. It's so great to see. I just was like looking in the chat and seeing all your names and where you're coming from today. A lot of names that I recognize, folks that I've worked with. It's really exciting to be here today with everybody. I'm Will Dominy. I direct the housing program at Health in Partnership. I'm one of the authors of the paper that we're releasing today, and actually right at this second, as Sari puts it in the chat. And this paper, I'm really excited about it because it's the first moment, and this webinar is kind of the first moment, where we've seen a wide variety of public health organizations laying out the evidence for rent control as a health intervention. It's really new and it's a really big deal. We wrote this paper alongside a number of co-authors and in partnership with organizations from the Public Health for Community Power Coalition that Mariana mentioned, and Raya is going to get into this a little bit more. And it's much stronger for it. Thank you so much, all the organizations and folks that helped with this. And also just to say that paper and our thinking on this also evolved from our research director Sook's piece in PolicyLink's recent report, which we'll also put in the chat and Jasmine will talk about today. So we're here today to talk about modern rent control policies, which set a schedule of predictable rent changes while ensuring landlords a fair return. And these are often called like moderate rent control policies, and they shouldn't be conflated with the strict price ceilings of really early rent control. It's a different policy mechanism. Well, it's a similar policy mechanism, different policy. And it's a top priority for tenants. It's easily understood. It's popular with voters across the political spectrum, including in swing states, and it's good for health. Sari, if you could go to the next slide. Our contention is that rent control slows rent growth and increases stability for the homes that it covers. And I think this is really backed up by the literature. There's been lots of back and forth in the research about rent control's effectiveness, often driven by real estate aligned interests. And we'll get into a short description of this in the paper, and PolicyLink's report has some really incredible myth busting, including from the economics field. So I think if you want to dive into effectiveness, I'd send you towards PolicyLink. And then our take in the paper is that it is effective, but that it's not a silver bullet. Rent control needs to be paired with a broader array of strategies that make our homes more affordable over the long haul. But without rent control, those other policies won't have time to work. So again, our contention is that rent control slows rent growth, makes homes, in doing so, makes homes more affordable, and then also improves stability. And that both of those things have benefits for health. The research on both is incredibly strong. So on affordability, we know that when you can afford your home, there's fewer unhealthy trade-offs, right? Like sacrifices for food or medical care. You can prevent the range of health impacts associated with unaffordable housing, including for children, for seniors, And then most dramatically, increases in rent burden have been associated with increased mortality risk. So affordability saves lives. Stability also saves lives. There's also a strong research base at both the individual and collective levels. Individually, there's just been like a huge growth of research on this lately, finding that unstable housing and eviction are associated with a wide range of health impacts, homelessness, and also mortality risk. There is also strong research, but often less focus on the community level impact. But what we know and what the research tells us is that stable, rooted communities allow us to take care of each other, protect one another, especially during disasters or political moments like this. And they allow communities to exert political power by organizing together and by increasing voting power. And exercising that power is what it takes to win the kinds of things that make communities healthy. And our policymakers have made decisions over the past decades and indeed centuries that show how deeply we value that kind of stability from homeowners. Like no one questions that for homeowners. And the time has come to really level the playing field for renters and make sure we all have that kind of stability. Next slide. I'm actually realizing I skipped over a number of slides. So Sari, if you could go to the preemption slide. And a big piece of the problem is landlords' power. Corporate landlords now own nearly half of all rental housing in the US. And recent research, including our own, which Sari will put in the chat, and legal actions have pointed out the widespread use of rent-setting software that allow landlords to collude and systemically raise rents. And we're seeing many of the same actors using their wealth, their lobbyists, and their lawyers to strong-arm policymakers and block the policies that protect health. And in public health, like this isn't the first time that we've seen this playbook. We saw this before when big tobacco poured millions into feeding and preempting policies to help people quit smoking. And we can't let that playbook go unchallenged now. So at the end of the paper, we get into some of the roles that public health can play. And we use the 10 essential public health services as the guide. And we'll get much more into the details of what this will look like during the panel discussion. So here I'll just make a pitch. Housing justice movements need support from those of us in public health. I see a lot of housing justice folks on the call, and like you all are doing great, like so much power to the work that you're doing. And also I know that when other sectors, when other folks come into alignment, we can be so much more powerful and can really help housing justice campaigns. And research has shown that health framing is one of the most persuasive ways that we have to motivate people around housing solutions. So I think if there's one task I think we have ahead of us, for those of us in public health at least, it's to position our research, our spokespeople, our field's collective power behind rent control's effectiveness as a health intervention. And we need all of you in that. And there's roles that are appropriate for every kind of organization. So let's talk more about how we get there and then what's needed with our wonderful panel. So if you could, panelists, if you could come make yourselves visible. So this is going to be more of a discussion than a formal panel. Folks that have joined today, there's time and questions for your thoughts near the end. Please use the Q&A, as Mariana mentioned, and we'll kind of pick those questions and pose them to some of the panelists. And we had originally intended this part to allow you all to come off mute and really engage in like collective strategy, but we had so many people register that we had to switch to the more formal Q&A tool. But we still want it to be a strategy session. So we'd especially like to hear and make space for any questions or thoughts that you have about how public health can move into alignment with rent control campaigns and the roles that the health sector can play. So I will just like very quickly introduce our panel. We have Jasmine, who is a senior housing associate at PolicyLink. She's part of their fantastic housing team. They're convening and supporting rent control campaigns across the country. And they recently published the research that we shared above. And we know Jasmine from working with her, bringing a public health perspective to right to counsel campaigns. So she has some of this experience of like helping to bridge the two fields. And she's fantastic. We're really lucky to have her. Welcome, Jasmine. Carolyn is the ED at Homes for All Massachusetts. They are a hub of housing justice organizing in the state, and they've just been real leaders. Like I always, like every couple of years, I kind of like check up on what HFA Mass is up to because they really have led in building some of the kind of collective power and infrastructure that we need to transform our housing situation. And they're leading currently both legislative and ballot initiatives to undo preemption and rent control in Massachusetts. And they've been a very welcoming partner in welcoming public health in and thinking through the roles that we can play. So welcome. And then last, Raya is a program manager at the Center for Health Policy at the American Public Health Association. And we know Raya from all kinds of different places, but recently from her work with the Public Health for Community Power Coalition. She's going to be kind of repping that coalition today. And she's an incredibly helpful partner in thinking about how we sort of leverage our institutional power in public health for justice. So let's get into it. Jasmine, let's start with you. Can you give us some context about where the movement for rent control is at now? What are the campaigns? Where's the energy at? And then what do you need to be successful? Yeah.
Yeah, thank you so much, Will. So the movement for rent control has stemmed from millions of people across the country that are fed up with the high costs of living. Even with healthy wage growth in the last few years, the cost of rent has still remained extremely high and continues to rise, squeezing renters' ability to afford housing in addition to groceries, education, and childcare, all of which are also increasing in cost. Evictions are also rising across the country before and following the pandemic, and all are connected to rising rents and corporate ownership. In response, communities across the country have been starting campaigns to build power and win rent control in their communities. In fact, an overwhelming majority of renters and homeowners are now in favor of rent control. And politicians who support it are also winning their elections. Campaigns have been happening all across the country. We've even seen some more, and we've seen some more campaigns come to light after the COVID-19 pandemic, all varying from statewide to local campaigns. We most recently saw some rent control wins in Passaic City, New Jersey. And there's a huge statewide campaign happening in Massachusetts right now that we're going to hear about today. So excited about that. But if folks are thinking about running their own campaign, I would suggest reading our latest publication that I'll drop again in the chat, which serves as a toolkit for anyone starting or continuing campaigns for rent control. It covers topics from what is rent control, understanding the battleground, and a step-by-step guide to winning rent control that covers topics like policy design, legal foundations, and much more. And if you like what you read in the report and want to connect with a host of other organizers and advocates across the country who are advancing rent control campaigns, reach out to us at PolicyLink and we can get you connected with our rent control club.
Thanks, Jasmine. Carolyn, can you tell us a little bit about what's going on in Massachusetts and then also how it fits into kind of the broader movement for rent control across the country?
Yeah, thanks so much for having me, and so good to see many folks I know and who are in this struggle and have really informed a lot of the work we are doing here in Massachusetts, have answered late night, very weedy questions about policy, as well as have been on the ground with us. And to welcome new folks in, I think this public health frame is critical to how we're gonna build our narrative to win a statewide campaign like this. So in Massachusetts, as you could see on the map, rent control is preempted in our state. We are basically the only state in that kind of northeast corridor where that's true. And so within the national context, we do see what we are able to do in this next year as opening more room for more states to look at preemption and overturn preemption in their own states, which we know is part of the right-wing playbook that has gotten us here. So our campaign started as a traditional legislative campaign. Homes for All Massachusetts is a statewide coalition of tenant organizing groups who are on the ground in Springfield, in Lynn, in Boston. And I say our mission is twofold. One is to expand where there is tenant organizing in the state into other smaller cities. And then also to be the state policy vehicle for the grassroots housing movement. And so, for the past 8 years, rent control has been top of that priority list. Rent control and foreclosure prevention have been our two priority policies. Massachusetts also has one of the least productive full-time legislature in the country. It is super majority Democrat, but very entrenched, and very few people in leadership control totally what happens or not. So we've been doing our traditional, organizing in districts, meeting with legislators, going to hearings for years. And in Massachusetts, collecting the signatures to run a ballot question is one lever that we use both to go to the ballot and also to push the legislature toward taking some sort of action. So while our bill we have been working on is local option, meaning cities and towns can enact a rent control policy, our ballot question actually is a statewide rent control policy. Which has been modeling a lot of the policy advice we've gotten from folks on this call and through Policy Link and Right to the City. And so I'll quickly say we collected 124,000 signatures of voters in about 10 weeks this fall. We collected signatures in every county of the state. You have limits on how many per county. And we submitted about 90,000 registered voter approved signatures to the Secretary of State, and we anticipate to qualify for the ballot in the next week. And we were the only people powered campaign this cycle. So some of the campaigns they spend, $1 million getting a paid signature firm, but we're really using this as a power building opportunity to be on the ground talking to folks. And what I'll say is in every corner of the state, this makes a lot of sense to folks. We know this is an everyday affordability issue. It speaks like people, I think Will and Jasmine said a lot about the national campaign that I would have said. And but I think it's really true that this speaks to people across the political spectrum. One thing that I've really taken over the past 3 months is every everyday person hates corporate landlords. So if we can cut through and really talk about this as people, everyday people, working class people versus corporate interests, I think we're able to move many types of voters and many types of communities. And I think there's a lot of opportunity with the public health frame. And for us, and I think it's representative of the Right to City campaign. So I'll just say to end that, we really see one of our co-anchors, Rose Webster Smith at Springfield No One Leaves, often says that, rent control is the tourniquet while we are fighting for a different housing system, for social housing, for housing that's for people, not for profit. And I think the Right to the City campaign is really one way to use experiments around social housing and these rent control campaigns at state and local levels for us to build power now, but always with that longer term vision toward really fundamentally changing the system so that it works for people across our states and across the country.
Carolyn, just really briefly, can you say what's at stake in Massachusetts, for the rest of the country? I understand it's kind of a little bit of a linchpin of what's going to happen in other places or what's possible in other places. Can you just say, speak very briefly to that?
Yeah. So, one thing is this would be the most well-defined policy at a state level. And so I think there's a lot of opportunity, there's a lot of conversation right now about how we build state power, right? That we have to be building at the state level. And I think generally this is a real experiment in how can we do that and get the kind of policies that we know work for our folks and are not totally compromising on their everyday needs at a state level. And also we know there are other states that are exploring lifting their preemption, lifting the ban on rent control. And we know that the national corporate real estate industry will spend in Massachusetts to defeat us so that momentum is not gained. But we know that this is popular across the country. We've also done polling in Massachusetts that shows what national polling, I'm sure everyone's seen, shows around rent control. So yeah, we see it as, often for those of us in the Massachusetts, New Yorks, Californias of the world, our political context can be quite different than most of the rest of the country. But I think right and corporate forces also see that if they can defeat things in our context, then it can really suck energy out. So we see this as part of building serious energy across the country, and we take very seriously what's at stake if we are not able to get this across the finish line for this massive energy we see. Again, particularly Florida, Georgia, Colorado are places we work closely with, but we know across the country.
Yeah, thank you. And you already started to get into the opposition a little bit, especially from corporate landlords. I'm wondering if both you and Jasmine can share just a little bit more about like who the opposition is, how they're framing their like what does that opposition look like in practice, and then what role do you think that the public health could play in sort of helping to counter some of that momentum? Maybe over to you first, Jasmine.
Yeah, for sure. So I think we've touched on this a little bit already, but the opposition is really, limited to special interest groups that represent the real estate and corporate landlord lobby interests. Both of these groups, they're highly well resourced, and their lobbying efforts exert enormous influence over all housing justice policy, especially rent control and other tenant protections. And they coordinate nationally, statewide, and locally. They're so well resourced. In our report, we noted the research that we conducted for the report. We saw that the housing industry associations raised 1.86 billion in revenue and spent 326.7 million in lobbying. But most other people are just in support of rent control or are neutral. So that means that they can be swayed in one direction, one that we would like towards our direction. Um, and our report also has, similar findings that Carolyn kind of talked about too, of, there have been surveys that have really shown how much different demographic groups, regional groups, and even political groups support rent control. And we know a lot of the mainstream messages about rent control have been created and amplified by the real estate and landlord lobbies to protect their profits. But organizers can effectively use research, data, and community stories to push back against this misinformation about rent control and plant new narratives that catalyze the broad public support that already exists for stable, affordable housing for all. To that end, within the report that I dropped in the chat, we crafted an inoculation toolkit that presents all the evidence and talking points that you can use to correct common misconceptions about rent control and its impacts. But what the public health field can do is continue to educate the general public, policymakers, and important influential people on the clear connection between public health, displacement, and homelessness. To that end, the field can continue to provide robust research and data for organizers and advocates to showcase how public health impacts like what are the public health impacts that happen when rents are not controlled or stabilized? And equally important, it's good to publish similar findings when housing is stable to uplift what the benefits are for stabilized housing for communities over time. And I think the last thing that I'll also mention is that the public health field can continue to build up narratives that showcase how rent control and a broad set of health protective housing policies can ensure our families, neighbors, and communities can access housing and benefits for all of us for generations to come.
Oh, I think Will. Yeah, maybe oh, sorry, Will. Yeah,
No,
I'll
go
jump
for it.
in. Yeah, I think, I think everything Jasmine said is right on. And I think at a very, basic level, when we're talking to legislators, when we're talking to other folks, we're kind of, they're all like, we don't know about this rent control thing because they're hearing about from corporate real estate. But at the end of the day, we're kind of like, well, what else? What you got for us? Like, what are other ideas? And we're really, housing is the number one issue in Massachusetts. It's wholly unaffordable. And all we get back is, well, we just need to build more housing. And it's just very trickle down. It does not meet the needs of people right now. And it does not account for the kind of corporate profit driven nature of how we build housing in the US. So I think there's a way that the public health frame can kind of cut through some of that whole conversation and to say, this is about stabilizing our communities. This does have research behind it because we hear all the time this kind of like, well, we don't know, it's untested, blah, blah, blah. And I think that, our folks know why we know why rent control resonates with everyday people, but when we're translating that into convincing, a legislator or convincing someone that we should actually do this, I think having the data and having the kind of public health frame really allows us um, to expand the conversation and to have the kind of conversation we need to have with decision makers to complement the work on the ground that we're doing.
I'm not exactly sure how to frame this because I'm taking like some of the audience questions already, but I think someone expressed some interest in like how do I engage with builders and developers and other things like that. And I know, Jasmine, in your report, you did engage with some of the research about like what does rent control do to new development? And I think there has been some opposition arguments in particular that are like, oh, it can really squelch new development. Can you speak to that a little bit? And then also, like, if either of you can offer some suggestions about like how do we either design policies to to like how do we do that task of having rent control be part of a broader set of solutions? Yeah, can either of you take that set of questions on?
I mean, I would first say there is a lot of good stuff in the Policy Link report that Jasmine shared. And there are a lot of folks on this call who have done a lot of that work. I mean, I think that it's interesting, right? Because I think about it in two ways. I mean, kind of with our broader goals and the kind of social housing vision uh, in view, I really, for us, we say we need to do many things and that includes, stabilizing people now and building housing that actually works for folks. I will say, though, to be totally honest, in a very short-term campaign way, I think it is a hard conversation and we're kind of deflecting it and saying, we have a 10-year new construction exemption. We believe we need to build too, and leaving it at that. But I think it's a challenge, right? Because that's the kind of conversation we have to have now to win a policy like rent control. But, we all, at least in the Rights to City world, come into this with also an understanding of what the long-term vision is. And so I think I struggle with in the like day to day when to really bring in the whole vision and when to say, this is just not, this is just two different conversations. We need to build more, but also we need to stabilize people. So yeah, but I think it's a challenge we see all the time, and we are in a state where the vacancy rate is quite low. So it may be a little different for folks who aren't. But the last thing else, there was an interesting article today in Worcester, which is the second largest city in New England. It said rents are cooling. But what the actual text of the article says is that essentially they built too much luxury housing and they can't fill those units. And so I think there's a lot of opportunities for us to push in moments like that to say that's why we have to also build a different kind of housing while we're stabilizing tenants. But I feel like we should have many more discussions on the supply discourse. And I think Professor Getz, who I saw is on the call, is also an excellent resource on all of that too.
Yeah, and I guess the only thing that I would add is that, rent control is really just a tool that is helping us bring rational thinking back into the housing market. Right now, it operates at like an extreme, like Carolyn was saying, they're just building luxury housing. And there aren't a lot of guardrails in place for business people to, you know, behave in a rational manner that's not just exploiting and extracting rents from people to no end. And so, we have shown and talked to time and time again developers that, this is not going to squander your profits or your bottom line. Rent control still allows for fair returns on investments. Um, it's just no, it's just protecting people against really greedy for-profit corporate landlords. And that's a protection that people really need in this day and age.
Yeah, thank you. Okay, great. Let's go back into public health land. Raya, can you tell us a little bit about sort of what's happening in public health around rent control? Yeah, take it away.
Excellent. Great to be here. Thank you all. And thank you both, Jasmine and Carolyn, for all that you've added and all of the wonderful examples and very clear instructions for public health to take away from this conversation. So thank you so much. I just wanted to take a moment to reiterate the points that have been made. But as we all know, housing is a social determinant of health. People deserve to have an affordable place to live. When people have stable housing, when they don't have to move out, when landlords jack up the price of their home to an unattainable amount every year, they're healthier. People can afford to stay in their homes. They can afford to, buy their medicines, their food, all of those things. When we put people over profits, people can live in healthy homes and also afford their basic needs. The public does not get healthier when housing prices make corporate landlords rich and force our neighbors up from their homes. Public health needs to stand on the side of people power to make real change here. And that's really what brings me to discussing the Public Health for Community Power Coalition today. People in public health may be feeling stuck. I mean, this is a moment of inflection for a lot of us. The Public Health for Community Power Coalition presents an opportunity to work with community power building organizations to help each other achieve our shared goals. The Public Health for Community Power Coalition is, as Mariana mentioned, a growing network of non-governmental public health organizations coming together to strengthen our role within movements for racial, environmental, economic, and social justice by supporting grassroots organizing groups, also known as community power building organizations. We launched in 2024 as a response to the urgent call from these community power building organizations. And we see that public health has a unique opportunity right now to help build community power and to protect both our health and democracy. As attacks on our communities escalate, so must our collective power to defend them. The Public Health for Community Power leverages what public health can contribute to these movements, what we do best. As we've talked about already today in this conversation, public health can contribute, those things that we do. Data collection, communications, messaging, research, all of these things are really important in the fight for health and the fight for rent control. I'm actually a renter, and on my own time, I organize in a tenants union at my apartment complex. I know that having data and research to drive home the positive health impacts of rent control helped advocates pass a rent control law in my county that I now benefit from, and so do my neighbors. While some of us may face limitations in our institutions, there is an opportunity to get involved outside and where we live even as individuals. I also wanted to just take a moment to briefly speak to what the Public Health for Community Power Coalition is doing with Right to the City. The Public Health for Community Power Coalition is working with Right to the City to bring the field of public health along in this fight for affordable housing. There's a growing consensus amongst public health. More and more, the field of public health is coming around to the idea that building people power, like the suite of policies that make up rent control, is the most effective way to improve conditions for our communities. One way we're doing this is through communications like the paper that we've presented here today and that we've shared. The paper does a really great job, as Will mentioned at the top, of framing rent control in terms of the 10 essential public health services. So I definitely recommend checking it out if you haven't already. And we continue to explore and strategize on how we can support campaigns such as the Massachusetts campaign through narrative change and through the other things that public health does best.
Thanks, Raya. How can we think about can you get into a little bit more specifics about how do we meet the needs that Jasmine and Carolyn are putting out in terms of the ways that we could plug in? Do you have any thoughts about specifically how do we kind of dig in? And we being those of us in the public health world, I realize there's both housing and public health people in this call.
Yeah, I can start off with that. I think one way that we see an opportunity for the Public Health for Community Power Coalition is to mobilize the field of public health through, bringing the public health field along in this space and leveraging our connections, making connections within our public health networks, connecting organizers and community power building organizations with the people that we work with every day. We've talked about, specific narrative strategies for advocates around not only, to use Jasmine's example, not only for when we need to make the case that the rent control is important, but also after rent control policies are passed, in order to show their effectiveness and to have that data, that long-term data, so that we can translate those movements and those that narrative shifting to other states and to other localities. Some other ways that are on the table for the Public Health for Community Power Coalition is through doing op-eds, news stories, and having, public health figures and spokespeople really sign on to and champion these narrative strategies. I think one other way that we've talked about in the Public Health for Community Power Coalition is through framing and research and narrative strategies around housing, the importance of affordable housing, the importance of rent control, and those longer term visions around, social housing and housing that works for everybody. I think in many ways, the goals of our housing advocates and public health are very intertwined, if not exactly the same. So I think there are just a plethora of ways that we're doing the work that we do every day and that can contribute towards these long-term shared goals.
Thanks, Raya. Carolyn and Jasmine, like, is there anything you want to dig in from that in terms of like, yes, and we need you here, or like, here's the types of things that like, we have whatever it is, like 250, almost 250 people on the call. Like, where do you want to like direct people's energy?
Yeah, I think one thing that stood out to me from what Raya shared is, partnering with campaign leaders to be in the right step with the narratives, data, or research that's needed for a campaign to succeed. Don't be afraid to join the coalitions that are needed to move this work forward. That could mean coordinating regularly with campaign leaders to understand what research gaps, messaging frames, or public-facing materials are needed at each phase of the campaign, making sure that public health voices are present in coalition meetings, strategy sessions, and communications planning, so health expertise is deployed at the right time, and being willing to join, endorse, and visibly participate in coalitions so that health institutions lend their credibility and political weight to rent control efforts. I mean, just involvement there is key.
Yeah, I think I totally agree with Jasmine. The only thing I'll add is that I do also think, in Massachusetts, we've had some luck when folks can, figure out the internal structures to get endorsement or support from institutions. That does really help us as we're doing all the narrative building research support that Jasmine's talking about. So I would say while you're doing all that with the campaign, also exploring like which health institutions you have access to and how can we start to get those kind of voices to support, to show that how broad and how mainstream basically this work is.
I want to dig into that a little bit more and bring in some of the things that are coming in the Q&A. There's a number of questions that are about kind of like, how do we really target and make sure that we're supporting renters, and in particular, the people with like the lowest incomes or the most like unstable housing situations. And I know that's a housing justice value, that's a public health value. Like, how are we making sure that the folks that need support the most are receiving attention and getting policies that work for them and building policy and building power in those communities. And then also there's this like build a broad tent kind of question. And there's some questions in the chat also of like, how do we build support among homeowners? And like, what does that broad support look like? And like, I don't have an exact targeted question here, but it's sort of like, how do we both continue to prioritize the power and leadership and needs of the folks most harmed by our current housing situation, and then also start to build towards this thing of like, yeah, this is something for all of us. Like, this really does matter for all of us, and bring other folks kind of into that coalition. Do you have thoughts on that? And just to add another ripple, and also like how health could like help do that.
I mean, I don't know. There are a lot of different pieces there. When I think of rent control in terms of the housing justice movement, I think that it's really important that it's a more universal policy, that it speaks to a large population in a state like ours. And, for us, we're very clear to win with the voters, you also have to speak to why it matters to homeowners. So for me, like, that's kind of like the big narrative, big tent piece, right? That's what rent control is for. It's to capture the largest base. It's to contend with this just build more housing narrative. It's to do all those things. But as Homes for All Massachusetts, that's right. Like we also, we have like we kind of frame our work around four pillars, and one of them is housing our unhoused neighbors. And we have been trying to defend Massachusetts' right to shelter law, working on camping bans and other work as just one example. And then obviously, supporting rental assistance and those kind of programs. So I guess I think that's right. There's not the thing about housing is there's not going to be like Will said at the beginning, right? There's not a silver bullet. There's not going to be one policy that addresses every piece of the puzzle, but I feel that rent control is the piece that can shift the power dynamic so we can get more of the things our people need desperately, and that builds a new consciousness around housing in our cities and in our state, where more and more tenants, working class homeowners feel connected to the movement and will hopefully join that struggle to also do those other to improve or change those other policies that we see.
Anyone else want to take a crack at this?
I think there's also some like truth telling that needs to be done in these like conversations with homeowners. And reminding them that they have rent control built into their fixed mortgage rate. So, and many other protections in place for homeowners, because our society has basically bifurcated homeowners and renters into two different classes of people or classes of groups that have, quote unquote, different interests, but, and we're continuing to treat them as though they have different interests, but they don't. And so it's a lot of like reminding people that, renters don't have the same protections. Like we're just equalizing, like we're leveling out the protections that you already have and giving them to people that are, that they just happen to be renters by no fault of their own, or maybe it's their own, like their preference, which folks are allowed to have a preference to be renters versus homeowners. And that they're still entitled to having similar consumer protections that homeowners have.
Yeah, I will just, I don't have too much to add here, but I will just say that I think that's a really important point, Jasmine, and that ultimately, like, our communities are healthier when, renters and homeowners get their basic needs met. And I think that, I think the case for collective power here is that, like, in a community where there are renters and homeowners, like, the community becomes healthier when renters are able to stay in their homes. And so like that is a win for that community. And I do think it's an important reminder and slash call to action to the public health community to center those people who are most minoritized or most marginalized in these conversations, because it's easy to say like, it's easy to, it's easy to have kind of pie in the sky discussions about what rent control would look like or what housing would look like without actually really thinking about like our houseless neighbors and the people who really have, potentially the most to lose in this situation. So I think it's a really important reminder to the public health community to center those folks in these conversations and in the research and how we approach these topics.
Totally. And I would just add like sort of an editorial note, like I feel like part of the superpower of public health is that we're public, right? It's not just like an individual person or family's trajectory and like how are they doing as a renter. It's like looking at whole communities and trying to understand like what makes us broadly as the public healthy. And I feel like that's a story that we really need to lean into as public health, of like telling the story of like I've been thinking about it a lot in the context of my own neighborhood. Like we have a very connected, stable block, and when my kid like goes running off down the street, I know that everybody's got eyes on her. And like that is a public health gain. Like when the house down the street caught fire, like I knew someone was going to come and be like, here's what's up, and like anything that you need to do. When like ICE was in town in a more serious way, like I knew that like we offered support, to folks that might need it in that time of like dropping kids off or something. And like I feel like we also need to like lean into our ability to tell the story of that like collective support, collective health, public health, like the benefits of stable communities. So I would just add, I think that's another place that like we can hopefully contribute to that story, and like bumping it out of the individual frame and into like what actually keeps us all safe together. Okay, so I guess like one last question, for now. We're in, as Mariana mentioned, we're in like some pretty intense political times. That's an understatement, but we're really seeing like increased authoritarianism and attacks on our folks, including the attack on the very idea that government should be caring for people, that we should be caring for each other. And like, how do you see rent control campaigns in this context? Like both as we like zoom out to the macro context and also to the like, how do we keep our neighbors housed? Like, how do you hold those things together?
So one thing that I'm reminded of, and I'll take us back to early November, is, coming on the heels of Zohran Mamdani's electoral victory in the New York City mayoral race, which, thanks to the tireless efforts of organizing groups in New York City, including Housing Justice for All New York, it showed how much potential there is to transform tenant power into governing power. And it's important to note that, the campaign activated a strong cross-racial, cross-class solidarity and shared prosperity narrative, and did so in a way that didn't shy away from, economic populist messages like freeze the rent, that clearly resonated with voters. So I think that this win, and, I'm getting similar vibes from the Massachusetts campaign right now. We're starting to see them as fights that contend with power in the real estate market that quickly evolve into civic engagement strategies that overcome race, class, and income and gender barriers to build a multiracial democracy that we need towards to govern. To have a more functioning democracy. And rent control campaigns are just helping us to bring the power back to the people and continue to unlock powerful wins, regardless of the mess at the federal level and the attitude that the federal government wants us to believe government no longer has a role in our lives. But that's kind of where I'm sitting with this connection.
Anyone else?
Yeah, I think to what Jasmine's saying, right? I mean, we really think about the block and build frame, and we have to have something that's building, like whether it's contending with neoliberal Democrats in a state like Massachusetts, or the far right at the federal level or in other states. We both need to block the worst offenses happening, the worst harms on our community, but we have to give folks something to fight for, and to believe in together and to work toward together. And I think even from this small glimpse of doing the signature drive, we have seen that in action. And in a state like ours where it's basically one party Democratic state, like we have felt this ballot question as a way to really bring the power directly to the people, not just talk about candidates who make a promise that they may or may not deliver on, but how can we as people coming together, fight for the things we want and need, the things that speak to our communities, and actually come together to build the power we need to do it.
Yes, and I'll just add that I think, I mean, this time is not a great time for public health. It's not a great time for all of our community's health, and public health in many ways is under serious attack and is going to need to seriously rebuild. And I think this is an opportunity for us, really, as public health, to decide what we want the future of public health to look like, but also how we can achieve our goals. Because right now, we really need to be strategic, and we really need to rethink how we achieve our goals and how we keep our communities healthy and safe. So I think this is a great opportunity for us to reimagine that and to lean into our shared goals and to leverage these partnerships in where we're aligned with organizers, where we're aligned with community power building organizations, because we are not in this alone. There are so many other sectors that believe the same things that public health believe. And I think that this is an incredible opportunity for us to leverage that.
Thank you. I think that's a great point to end on. I also, this conversation had me reflecting. I just found this Cabral quote the other day that I'm going to put in the chat, just about like the connection between democracy and people's like real needs. And he was writing in like a different context about national liberation and decolonization, but I think it's like really relevant today. Anyway, so from that, I just want to thank you, panelists, so much for your time today. I really appreciated this conversation. I think it gives us a lot to sink our teeth into. And yeah, just like, thank you so much. And I'll turn it over to Mariana to take us out.
Thank you again. Just want to echo Will's gratitude to all the panel speakers. So much rich information that was shared today. Some really exciting work that's happening in Massachusetts and in other places. So just once again, thank you. But also just want to thank all of you all for joining us today. We hope that you will dive into the health benefits of rent control brief, which we're going to share again in the chat one final time. And we'll share in an email with all the links that we shared in the chat, all the, the recording and slides. So be on the lookout for that. And I can't end a webinar without a call to action. We want you guys to take this information and plug in, take some action. Everyone has a role, as we've shared today. So if you are based in Massachusetts, we encourage you to continue staying involved or join the folks with Homes for All Massachusetts in this effort to win rent control across the state. We're actually going to be part of a conversation this Wednesday with the Root Cause Solutions Exchange, Wednesday, December 17th. We'll share a link in the chat as well to think more into the details of how the public health community can support the work at Homes for All Massachusetts to get rent control. Follow Keep Mass Home, the folks that are doing on the ground, trying to push for rent control in the state. On Instagram at Keep Mass Home. We'll also share that in the chat. For those of you who are in California, which I saw there was a lot of engagement in the chat from folks that were sharing their experiences in California, connect with the Housing Justice as Health Equity Collaborative, which is a group of health leaders working on housing justice, and learn more about the Affordable California campaign and the Affordable Rent Act, which is going to is proposing to lower the state's rent cap in California. And if you are in Monterey County, the folks in Salinas are trying to pass rent control in 2026. They qualified for the 2026 ballot, so there's a big effort to push for rent control there. You can follow at Protect Salinas Renters on Instagram to learn about ways to get involved. And then finally, if we could go to the next slide, connect with us on social media, including on Blue Sky, Instagram, Facebook, and LinkedIn, so that you can hear more about ways that folks in the health community, you all can plug in on housing justice and other important efforts across the country. So thank you all again. Appreciate you joining us today, and stay in touch.